One day I was having an episode, a crisis, in my left arm. Not even my whole body, my left arm. The pain was so severe, I wanted to put my arm on the space heater that I had in the room just to feel a different kind of pain sensation because it hurt that bad. A good day for me would be, first of all, to wake up without pain. That hasn't happened in a lot of years now.
If I can get through the night, with the pain of about an 8 or a 9 and wait for the infusion center, we actually do. I know it's not good because as a sickler, we can encounter other issues like strokes and things of that sort, which could be deadly.
I've spoken to sickle cell patients about how they don't come to the emergency department the moment their crisis starts. They try to manage it at home. They try and do everything they can at home. So when they've exhausted all their own resources, they come to us for help.
They don't want to come until they have to come, until it's too painful and they need our interventions and they need our care because they can no longer manage at home.
I feel like when you go in the emergency room as a sickle cell patient, the demeanor changes. They call us frequent flyers, and they don't even try to hide what they're saying.
In the past, it was dreadful, if I may say despicable at times.
I wait to go to someone that I know will not treat me any differently. They won't judge me, and they will have compassion for me. Because if you know about sickle cell, you know what we go through.
Some of them have been ignorant, not knowing how painful a sickle cell crisis is. And of course, for some of them, it has been, all I'm here to do is to get high. You can sense that. You can feel it. Though not said, you can often even get it through the way that they care for you and treat you.
I had to, put forth an appearance as though I'm not seeking drugs, and which was stressful in itself because I'm in pain and I have to worry about ironing a shirt or, before I go to the emergency room.
Patients are concerned when they come into the emergency department that there's a stigma associated with their disease, with this population, that providers are going to think that they're drug seeking. And so patients have out and out told me, I'm concerned that people aren't going to believe me, that they're going to think I'm seeking drugs when I'm in a lot of pain, and there's no way for me to prove that to you other than to tell you.
In the medical field, we tend to misconstrue the lack of outward signs of pain as not truly being in pain. Our patients sometimes appear to be comfortable because they're actively seeking distraction techniques. They are on their cell phone, they have movies with them or a game or something like that to keep them busy. But if you are the healthcare provider who doesn't know about those things or isn't consciously aware of those things, you walk by and you see the patient watching television, you think they must not be in pain. But in fact, if you went in and you actually talked to them, they're still experiencing their pain, and there's no way for us to know from 3 feet from the bed whether or not they're feeling the pain on the inside.
I was usually told, well, you have to wait another few hours before you can get more. You can't possibly handle this much medicine. You're obviously not in pain.
There are cultural factors that factor into how people will present with pain. There are social factors that factor with how people present with pain. And certainly there's, a tolerance to pain as well, so to speak, that influences how people respond to pain. Our clinicians and our physicians and our staff need to understand that you really have to try your best to take patients at face value in their self-reports of pain. And the more you understand disease processes like sickle cell disease, which really is associated with significant pain, the better you're sensitive to the population that you're treating.
often the patients are knowledgeable about what it takes to make them comfortable. They've already been on a regimen at home. They've already been taking some of those medications at home. And when they're coming to the emergency department, they know what works once they've gotten to this point in the crisis.
The amount of medicine that I was given would kind of be, it was downplayed.
My body has, over the years developed a tolerance to narcotics that, for some person would kill them.
I try to approach it as, what would you do for someone that was in labor? What would you do with someone that had pancreatic cancer and was writhing in front of you in pain? You would try to make them as comfortable, as quickly as possible, and as safely as possible.
I have had a couple providers who have met me in the middle, where we have, collectively, this is what works. And the provider has said, well, I feel uncomfortable. Talk as a provider. Tell the patient what you feel uncomfortable with. Express to them your concerns. So then the patient is able to express to you their concerns, and then you two together can meet a common solution.
Not only for sickle cell disease patients, but patients in general with any disease process that's specialized, or just with any disease process in general. I think we should think of our patients as our partners, right? Our patients are increasingly savvy, and that's a good thing. If we do a better job about educating our clinicians and physicians and nurses and staff about what sickle cell disease is and what the expectation is for this patient population, I think we can get over this, this stigma associated with it.
Over the years, we understand what we need, just like any other person that's dealing with any other chronic ailment, and we've done it for a large amount of time.
I think if you really just sat down and talked to us, you would really find out that we know what we're talking about, we know our bodies, and give us the benefit of the doubt. You understand? And stop being judgmental, because it really hurts. We're in there in pain, enduring some pain that I couldn't even imagine other people going through. And then for us to finally get seen and be talked down to or felt judged, that doesn't help us at all. That even adds to the pain.
One thing I know is when they encounter a provider that knows the disease and understands that they've been living with this, and understands that it's painful, there's some comfort there that I'm going to be taken care of.
Take the time out to listen to the patient. And understand that you can't be the judge of someone's motives. You can't be the judge of someone's pain.